are a little bit late. So welcome. Like I said, I'm Cheryl. Oh no, I'm Sherilyn Smith, and I'm the Chief Academic Officer at Aquifer, and I just want to welcome you to this webinar. We're so excited that you're here and that we're all going to learn together. I am a pediatrician at the University of Washington as well, and have been in many different roles in teaching medical students, from clerkship director to preclinical teaching, and I'm currently the clinical skills learning specialist at University of Washington as well. And this was me before pre-bangs, right? So here are our learning objectives. We're going to talk about the pedagogical underpinnings of Aquifer's cases, what makes them unique. We are all going to learn together, I think, about best practices for optimizing the use of Aquifer with learner level access. And we're going to hear from some great educators from around the country. We're also going to let you all understand what are some options for you to continue to use Aquifer after June 30th, once this free access expires. And then learning tips for using Aquifer cases in nurse practitioner education. We have a lot of our nursing colleagues joining us on this webinar, as well as other educators from around the world, actually, who are using Aquifer now in this time of COVID. That's what I sort of call this time now. So here are our session leaders, and you're going to meet all of them in the breakout sessions. Joyce Capello, you want to raise your hand, wave in real person, right? There she is. Hofana Pelliter is with us. It was Ellen and Linda Eastham. If you want to wave to Linda, she's got like this fancy headset on. Well, great. And then Leah Romano. Perfect. Love the thumbs up. And Leah Romano from Aquifer will also be speaking. So here's our agenda. We'll do a little introductions that we're doing now. We're going to talk about the Aquifer pedagogical approach. I'll transition then to Leah to talk about learner access versus institutional subscriptions. And then we'll all go to breakout sessions. And so we have 2 breakout groups as they're listed here. And then we'll come back together at the end for a final wrap up and questions. So please feel free to use your chat as we go along to gather to send us questions. We have people monitoring that. You all are great Zoom colleagues. You've disabled your videos, so keep that for right now. Please use the chat function. And once you go into the breakout sessions, I think that you're all going to be muted, so you just can unmute if you have questions, if the group is small enough, but continue to use that chat function for your questions. You're going to be moved automatically into the breakout room. So just realize that once we get toward the end of our presentation, off you go, and then you'll get some great learning together. So a little bit about Aquifer for those of you who don't know us. We're a mission-driven, not-for-profit, and we're dedicated to delivering the best healthcare education through collaborative development and research into the innovative, high-impact virtual teaching and learning methods. And we've been around as an entity since about 2000 and became an official not-for-profit in 2006. We started in pediatrics and were funded by HRSA grants to develop the first set of virtual teaching methodologies. And I will say that, really the heart of what we do is collaboration with educators. So we're so happy that our presenters are here and that you are all here learning about us and that we can learn from you. So my story, as I said, I'm a pediatrician, and in the early days, the reason that I was so excited about having a resource like Aquifer, it was called ClipIn, was because as a pediatrician, there's lots of variation, seasonal variation in the types of patients you see. And so all clerkship directors in pediatrics were struggling with the exact same problem of sometimes our students see a certain kind of illness in the winter, and those students in the summer, they don't see those types of patients. So we came together and partnered with the Clerkship Directors Organization in Pediatrics, wrote a whole bunch of virtual patient cases and launched. Since that time, I was an early adopter. I wrote some of the early cases. We've used it in pediatrics since 2000 when they were first available, and continue to do that since then. As pediatrics grew and more people used these types of cases, then our colleagues in family medicine, internal medicine, geriatrics, radiology, surgery all felt like this was a great way to move education forward and provide comprehensive coverage of curriculum in a really standardized way. So we've continued to partner with many different organizations to achieve that goal. And so we have a consortium of about 70 educators in a whole bunch of different specialties who come together and continuously update and improve the cases. So they were original writers, and then they've stayed on just like I have. As I said, I'm the Chief Academic Officer and stepped into that role in January. And the reason that I have continued to work with Aquifer for the last 20 years is I really believe in the approach of teaching. It's a big focus on clinical reasoning in an authentic, case-based manner that's interactive and really reflects what my colleagues and I think is to teach. So here's just an example of our impact right now. And you'll see most of this is in April of 2020. So all of you all have joined us in this adventure that has been induced by one small virus, right? And we are serving actually more than 500 health professions programs, getting the content for free. 165 nurse practitioner programs are using this, so it's well widespread, and we really are happy that people are getting to see the content and the approach that my colleagues have. As you can see, we have 13 national organization partnerships that's helped create and continue to improve the cases, and we give back as a not-for-profit to our partner organizations through grants that fund innovations. So as I alluded to, I think that some of the great value of the Aquifer in health professions education really focuses on the development of clinical reasoning skills. There are elements in all of the cases that really help students practice those really important skills that sometimes we take for granted when we're working with them clinically. So breaking it down, having a safe practice space is one of the key elements of this approach. I alluded to the fact that there's deep content. So all of the content in all of the cases reflects the national curricula with the partners that we create cases with. So for pediatrics, internal medicine, geriatrics, radiology, for example. And I think that we have this focus that Aquifer really prepares people to be excellent practitioners, not excellent test takers. So there's modeling. It shows them how to ask questions, how to think about patients, and not necessarily check answer B. And I think that all of this is really important for students and residents if we have residency program directors here, because they're not able to access patients. So I think that it really tees them up, and I've heard this from people that I've talked to throughout the country doing peer consults. The students will be ready to get back with patients. They've had this deliberate practice, they've had safe practice while they've been away. So what I'd like to do now is exit here, take you into some of the parts of our cases. So this is zoomed in as a student, and this is what your students see when they go in. So if you haven't had a chance, you have the opportunity to go in and see with the students. And so there is a whole course listing. So you all have access to all of the content that we provide in Aquifer, from culture and health, and some free courses, diagnostic excellence and high value care, all very important topics, to our signature courses, family medicine, geriatrics, internal medicine, pediatrics, and radiology. And so this is what the students will see. You'll notice here in the pink that they actually have access to some great resources as well. So there's clinical practice guidelines. Really, if you're using the geriatrics cases, I know some nurse practitioner programs have this focus on geriatrics. It's great glossary to help them get up to speed, as well as lab reference values. My favorite, I'm a pediatrician, is the pediatric developmental milestones, a great interactive tool for students to learn a topic that's kind of hard to understand. So let me go back. So what I'm going to do now, so again, deep content, I'm going to go down and show you kind of what's in the case. So I'm going to go into family medicine. So here are all of, so the students will be able to see all of the cases in family medicine. So this is, there are 36 cases here for them to choose from. And I'm going to swoop into Family Medicine 5. And this is what it looks like. So you'll see when the very first introduction, you see the student, the patient, and then their embedded questions. So they can write, you know, as I'm going to do right now, arrhythmia. They will be better students than I am and probably can speak, arrhythmia, okay? And then they submit. And then underneath, after they they put their answers in, then they have teaching points you can see here. So they will actually be able to work through a beginning differential diagnosis. As you continue, this also brings up another feature of the cases, and it really models, as I said, the types of questions that you ask and the appropriate answers. Cards have what we call deep dive. So if they want to learn more about a specific topic, it's embedded right there for them to look at, and everything is referenced. You can see as we're going through the history, the past medical history, so they can review this. It's all gated. They go into the review of systems, more discussion, and then they come up with one of my favorite things, to a summary statement. So they have to summarize what's in the case. What have they learned so far? And you can see over here on the sidebar that they can take notes as they go. They can put their diagnoses in. They can highlight the key findings and bookmark anything that's important. They're able to take notes as they go. And then this is a 30-year-old woman with acute onset palpitation.
Is there a way for them to dictate this note instead of type?
Great. No, there's not. But it would be, no, there's not. They do have to type. And they submit. And then here's the answer comments. So we actually give them what the experts say, what are the important points, and then they can continue. This goes next to the differential diagnosis. They choose their differential diagnosis and submit. Okay. And then we have teaching on this. So I'm not going to work through the entire case, but this continues to be gated. And at the end, they work through therapeutics, management, and in the end, they're provided a summary that gives them the important teaching points within the case. So to summarize, there are many different ways for them to interact with the elements of the case. They test their knowledge, and then they can actually type in things that you can use as an assessment tool that I'll get to in just a minute. I want to pull up the faculty toolkit that you all received, I think, to show you some more of the tools that you can use for integrating this into your learning programs. So right here in the teaching tips and integration. So you really go through some videos that we've made and some work that we've done to sort of say, this is how you could use it in a flipped classroom. We have a series of educators who have given us tips about how they use it in our user stories. And it reiterates a little bit about the clinical reasoning skills. When you're thinking about using these, I think that one of the things that was hardest for me as a clerkship director is figuring out which of these many cases should be assigned. And so what we did, we created some quick guides for you. And so this is just an overview. You have access to the educator guides, which are much more in depth. But this gives you an idea of, say, family medicine I was in again. So medicine 5 that we looked at, it's that 30-year-old with palpitations. And you can see there's the differential diagnosis right there. So if you're trying to figure out what content is covered in the case, you can look there. And then the final diagnosis is Graves' disease. So you can see how you might blend things together, either if you have an endocrine module, if you're really interested in, say, cardiac symptoms as the presenting complaints, or you want to do health wellness visits. Those are all outlined here. And so this goes through family medicine. I don't want to make anybody dizzy. Here, pediatrics, the same thing. Internal medicine, pediatrics, and then the last, radiology, okay? It's a little bit more systems-based, but again, all the students can access all of these as well. Some of the questions, so that's how to decide which cases to assign, and I would encourage you all to assign cases. That increases the likelihood that students will actually use them. The other two things that I want to highlight are how you track student work. People are really interested in that, and a little bit more about the summary statements. So looking here, you can do a couple of different ways. The students can submit a screenshot of what they're saying that they've completed the case, but probably the best way to do this is export their student report. So I'm just going to scroll down here and give you an idea of what the reports look like. So green means that they're done. They did a great job. Yellow is partially done, and red is they haven't done it or haven't completed it. And the students can actually click this export button and create this as a Excel spreadsheet, and you can get their summary statement that they wrote in here. So this is a great tool to say, yes, they're actually getting things out of the case. It's another way to interact with them and to grow their clinical skills. Here's what this looks like if it's actually in an Excel spreadsheet. So, and you get their summary statement there. So that's one way to track that's an important thing that many people care about. And then just the last note on the summary statement is that we've tried to make this easy for you. So an explanation of the summary statement. And then we went through all of the cases and downloaded the expert comments about what we think the case synopsis of the summary statement of the cases should be. And so this gives you a nice template to interact with your students to help grow their clinical skills or evaluate their progress through the cases, in addition to whether or not they've actually finished this. So, I think that, in just to summarize, and I don't know if anybody is keeping track of questions at this point because we have a few minutes. I've used these cases for a long time, and I know that my colleagues have as well. I think that they're really adaptable to the nursing curricula, and you're going to hear that in the breakout session about how some of your colleagues have done this. I think that there's some great ways to really help students improve their clinical reasoning and problem solving, and just with some of the tools that we have. And I would also say that assigning the cases and spending a little time up front about thinking how best to integrate them into your training program is time well spent. So I'm going to stop there, and I don't know, I can see that there's some chats, but I'm not going to open it up. Is Eileen or Jackie
Sherlyn?
or somebody?
Hi.
Yeah.
It's
Yeah,
Eileen.
go for
Hi.
it.
I actually think it's time to move to Leah. We do have some questions about
Oh,
assignment,
all right.
and I think those would be terrific for the breakout rooms. So thanks.
Perfect. So I'm going to stop sharing. Thank you, Eileen. I lost track of my time. So go for it, Leah.
Hello, everyone. My name is Leah Romano, and I am a relationship manager here at Aquifer, and I'm going to be reviewing with you some options for subscription, just a very high level. So if you'd like to continue using Aquifer content after June 30th, you have 3 options. And so we're going to go over each of them. Okay, I'm just moving my screen around. I'm sorry. There we go. So one option is the individual subscription, and it's very similar to the access that you have now, learner level, where students work through the cases online. The student also accesses their mobile app if they wish. The faculty can access resources online, much like what Sherilyn had just showed you, the toolkit, etc. And there is some project tracking, as Sherilyn described earlier, that where the students can share their progress with you. So on the left-hand side is a column that provides a little more detail, where it shows some content and the reporting, but also regarding pricing. So if there's pricing questions about individual subscriptions, the price is $75 per Aquifer course, per user, per year, and the year starts the date of purchase, and it can be purchased by a credit card. So that's the individual subscription. Now moving on, institutional subscriptions. So institutional subscriptions have a little more than what you currently see with learner level. They have administrative functionality, which includes a searchable case library, course reporting to track your student progress, custom course creation functionality, where you can take some of the cases that you want to assign and assign them to particular students and put them in a custom course. You also have user management tools, expanded educator resources that could go beyond what Sherilyn had mentioned. And then also at the end, we show that there are summative assessment options available through June 30th of next year, 2021. So there's more than what you see in your learner level access. So a little bit more regarding pricing. The institutional subscription is what the majority of subscribers use through Aquifer. And pricing is based on your enrollment, and it's individualized for your particular program. Now, due to COVID and the disruption that COVID has caused us, Aquifer has put together a grant opportunity for those who would like to continue using content with Aquifer beyond June 30th for the full Aquifer suite of courses and or both WISE courses. Now, if you want to learn more of that, the main contact at your program will have received an email if you're an existing subscriber, and then if you have learner level access, you will receive an email within the next week or so, the main contact, that will detail the grant options, pricing option, and subscription options available to you, as well as next steps. So we really do encourage you to look out for that email, especially because the grant application request form is due early June, and we want you to take use of that if that is something that you'd like to continue content beyond June 30th. So another option for you is our free course access. And as part of our nonprofit mission, we provide 29 free cases dispersed over a variety of courses where they cover key interdisciplinary topics. They're developed in collaboration with national organizations. Anyone can access them with or without a subscription. They're available through our website, where you can register and access directly there from our courses page. And with an institutional subscription, they are packaged within them. So that's something else that you can consider moving on after June 30th. That was very high level of the 3 options available, reminding you again, the 3 options are individual subscription, very much like your learner level access now, the institutional subscription, and then these free course access. tried to go really fast to make up some time. So what I understand is that we are now moving into, we're going to transition to our breakout rooms where we will join here together as a group again at 2:55. So I'm going to stop sharing my screen so we can move into doing that.